Dear countrymen and countrywomen, since my last two updates, the country has seen a more aggressive and sustained growth of the COVID-19 pandemic as opposed to the earlier month of April and May 2021. Over the past 3 weeks, the daily number of people testing positive for corona has increased from less than 100 to now over 1,700. This represents a growth of 17 times, 17-fold increase in daily cases. As a result, our epidemic curve is now on steep rise, with increased reports of death nationwide. Let's see that curve, that figure of the epidemic, the graph. The graph, you can see now on the left, that was the beginning, which grew very slowly, until about September, when it started going up. Then it came down. Then it went up in December. Then we brought it down. It was very low. Now it is climbing very fast and very high. Thank you. In addition, the proportion of people testing positive from samples tested, what they call the positivity rate, has remained as high as 17%. In other words, when you test 100 people, 17 of them have corona, which was not the case before. And yet, for us to control the disease effectively, according to other experiences, this number has to be less than 5%. We should reach a situation where, when you test 100 people, only 5 have corona. But when you have 17 out of 100 with corona, then you are in danger. There's also what the scientists call doubling time. Okweyongera emirundi ebiri. Ekibadde 10 nekituuka kwa 2. This is the time it takes for the number of cases detected to double. If the cases have been 10 in a week, to become 20 in a week. The shorter this time is, the more intense the virus is spreading in the community. These are measurements by these scientists that if it takes a shorter time for the sick people to go from 10 per week to 20 per week, then that means that you are in a bad situation. This time used to be 68 days in the past when we were fighting this disease. It will take 68 days for 10 to become 20. But now it is taking 31 days in just 1 week. This means that if no major shift in the response is done, the pandemic intensity will double in 1 month. We are experiencing very high hospitalization rates and death for COVID-19 patients among all age categories. The hospitals are full. They are full. Cases have now expanded to cover most of the country. When I addressed you 3 weeks ago, only 61 districts had significant spread of the virus. As of 16th of June, 108 districts, as shown in this map, have corona. The bad districts are which one? The ones with the red, with the pink. That's Kampala, Wakiso. You can see the ones who are the highest. Then the other pink ones are what? Let me see. These colors are not clear here. The pink ones are the ones which are, the green ones are the ones which are still all right. That's correct? The green ones, now you can see the green ones are shrinking, they're disappearing. The green ones are very few now. Most of the districts have the virus, but Wakiso, Kampala are the highest. They are the highest. Kampala, Wakiso are the highest. Now, the top 20 districts with corona in the last 21 days. Kampala, 15,347 in 21 days. Omutwaro, 15 mu bisatu 47. When I put it in our local language, it is clear. That's now Kampala. Kampala, eisemu. You Kampala, you fail. 15,000 people identified, I think, with the corona in 20 days. Wakiso is the next one. 2,214. The Gulu, Yedako, 636. Luero, 599. Mbarara, naite bagirese mabega, 541. Tororo, 352. Masaka, 312. Busia, zona ziriao, they are all following one another. Jinja, Mbare, Mukono, Soroti, Mpiji, Chotera, Arua, Yumbe, Kasese, Chiriandongo, Hoima, Kabarore, those are 89. Total 20,000 people in 21 days. Given the nature of this virus, the moment you detect one case, then it is a matter of time until the infections expand and the number increases. We have noted a number of danger signals in the trend of the pandemic. These help to alert us to how we are doing. Some of these include increasing number of daily COVID-19 cases per week. In May, we had 2,887 per week in the week of 22nd to 28th. In June, same 1 week, we had 6,308. Katumulaba, in the week, to go from 2,000 to 6,000. Now, in June, we've gone to 9,000 per week. The positivity rate, percentage of people who have virus in 100 people. In May, we had 10%. In June, 16%. June, end of May, beginning of June. From 5th of June to 11th of June, 17% people admitted. It was 12% in May, 10% in June, 8% in June middle. Increasing proportion of severe and critical cases. In May, it was 49 people. In percentage, out of the people with corona, how many were with severe symptoms? It was 49% in May. It went 47 in June beginning. It is now 57%. So out of the 100 people with corona, now 57% of them have severe or critical. It's no longer the other one that they are sick but mild. Bali bubi oba bali bibi ennyo. That's the situation now. And then the other one, which I had told you before, the doubling time. In May, it would take 68 days, 10 to become 20. In June, it was 36 days. In June middle now, it is 32 days. So it is taking shorter for the numbers to double. Okubyamu bbiri. Abalwadde okubyamu emirundi ebiri kati kitwala ennaku 32. Emabegako kyali kitwala ennaku 68. The rapid surge in the intensity of the pandemic appears unprecedented but still manageable using the similar measures we have used since last year at the beginning of the pandemic and in all our previous revolutionary endeavors in the past more than 50 years. Because in the past we had the same problems, AIDS, Ebola. When we take measures to prevent, we succeed. This situation was anticipated by the government and hence manageable because we have got correct diagnosis and the means to tackle it. To date, the country has registered a total of 68,778 COVID cases. Ezimanyidwa. The ones we know, the ones who came for checking. Where 973 patients severe, and 79 were critical. Out of this 68,700 something, 973 of them were either severe, 894, or critical, 79. These are currently on active admission at both private and public treatment facilities across the country. And 42 deaths were reported today. Today we lost 42 people. Just today, 42 people. This brings the reported total death to 542. These are reported and confirmed deaths by PCR testing, but there may be more deaths diagnosed by other means. However, we are cognizant that both the number of COVID-19 cases and deaths may be higher than this, and the Minister of Health will accordingly explain and update the nation on this later, some other time. However, apart from individuals falling sick or dying in the community or health centers without being tested, may falsely test negative. For example, the individuals may have taken the test and the virus is no longer in the nose or the throat, but the virus is in other parts of the body, or it has already started the body panic crisis, which in some cases may lead to death. Because this virus kills by provoking your body to kill yourself, or sometimes also killing yourself directly. It does so by causing an excessive allergic reaction, where the body, especially the lungs, produce a lot of fluids in response to the invasion by the virus. I heard them calling it cytokine storm, that the lungs drown themselves with their own fluids. Their own fluids produced in panic. Like a munyera, the munyera, when you have a cold, the munyera is yours. It's not the virus. The mucus is yours. The mucus is yours. It's not the virus. It is, but the virus provokes you to produce those mucus. 5 to 8% over the past weeks, as in the table above. This signals intense that the health system is beginning to get strained. We must do everything to protect the integrity of the health system. Since my address 3 weeks ago, the severely and critically ill COVID patients have more than doubled, straining the available oxygen supply. An average non-COVID critical patient consumes 1 to 2 oxygen cylinders per day. However, a severely ill COVID-19 patient needs 4 to 6 cylinders per day of oxygen. The current national daily oxygen consumption stands at 3,000 cylinders per day, where each cylinder is 6,800 liters. With the estimated COVID-19 patient increase in the coming weeks, the daily oxygen consumption will rise to 25,000 cylinders per day in one month, unless we change the course. This is nearly a nine-fold increase in the overall national oxygen requirement. The current overall national oxygen production, oxygen plants linked to our referral and national regional hospitals, including the private sector, is 3,000 cylinders against the daily consumption that stands at 3,000 cylinders. So according to this, actually the still in balance. This is what I'm seeing here. The current oxygen challenge we are facing is the availability of empty cylinders for distribution, or the oxygen is being produced, but the cylinders to distribute it are not enough. Of course, if cases keep expanding, it can also outstrip the production capacity. Anyway, it makes no difference whether the oxygen is there, but the cylinders are not there, or the cylinders are there, but the oxygen is not there. It's all the same. The patient doesn't get the oxygen. So we shall solve both. As I indicated in my last update, the current hospital beds to manage COVID-19 patients stands at 3,793 as summarized below. Mulago, standard bed 600, high dependence 300, intensive care 27. Mulago Women's Hospital, high dependence 60. All the regional referral hospitals together, standard beds 900, high dependency 115, intensive care unit 150. Non-body treatment unit 1,300 standard beds. Bombo Military Hospital 120 standard beds. The 7 Ministry of Health accredited private facilities 180 standard beds and 31 intensive care units. Bombo Military Hospital has got 10 intensive care units. So total intensive care unit beds 218 in the country. High dependence beds 475. Standard beds 3,100. But when the crisis was starting, I told these people to prepare for 42,000 beds. I told them, they're here, all of them. Prepare for 42,000. How did I come up with the figure of 42,000? I saw what was happening in Italy. And that's how they were. They were needing 42,000 beds. And I thought that was the worst case scenario in the world. You use it for planning your own. So there has been slow response among these people. When I say, why didn't you do this? I say, Minister of Finance, Minister of this, I get all sorts of stories. As noted above, unless we urgently intervene to reverse this, the estimates and observations by scientists show that the current number of people needing care will double in less than 1 month, outstripping our bed capacity. As a result of all the above, my strategic interventions to maintain the fine balance of pandemic control will hinge, again, this time as it has done in the past, on preventive health and urgent care for the severe ill. This is the crucial thing. Prevent infections so that few are infected, if at all, and because there are few, you are able to look after them. This is the whole formula. Yeah. In Europe, so many people died, and in the United States, I saw one clown calling himself a politician. Oh, the weak health system in Uganda, weak health system. The United States, I don't think they have a weak health system. But they have lost 600,000 people dead and buried. 600,000, we don't have a single district, not many districts in Uganda now have 600,000 people, population. I think it is only Arua, which may be 600,000. I think my district of Nsonga is approaching that. maybe Mubende, or the other districts. Wakiso would be among those with more than 600,000. So you can imagine all the people in Arua dying. Child, man, what, in the United States? Is it because they had a poor health system? Rubbish. They had a very good health system, but they did not manage the issue of prevention. So the very good health system was overtaken by the numbers. So the strategy, minimize, prevent infections, so that you have few people who are infected, if at all. Because remember that like in May, April, March, we were no longer having infected people. There were very few. It can be achieved. We were having very few people. And because you have got few people who are infected, then you can look after them well. You can look after them more effectively. So our strategy is preventive health, to minimize the numbers, and urgent care for the severely ill. This is the strategy, my dear countrymen, and women also. So don't say that I've forgotten women. All of you, countrymen and women. This is the strategy. Prevent, so that the few who are infected are able to be managed effectively. This will be tackled in two ways. A, urgent interruption or minimization of community transmission to cushion the health system, sustain our people's economic lives, and save lives using previously used containment measures. As you can see, I'm now a puppet of Dr. Musenero and her group. I'm just reading what they wrote for me. Just a good puppet. But so I'm using their language. Their language is not easily understood by we ordinary people. What they mean here by community transmission and what they emazokuyingira mu bantu. The sickness has already gone in the population. I think previously they were using the word imported. Imported. That is when the disease was still coming from the truck drivers. You remember that time? Was coming from the truck drivers from Kenya, was coming from Dubai, from the airport. They were calling it imported or what? So that was one category of oxiga, of infection. Then there was what they were calling contacts of the imported. Now, what they are talking about is that the disease has already gone into the population. So when you hear me using Musenero's language, understand what it means. It is community, what do you call it? Community transmission. Means of what they bwamarada okutuyingiramu f'abantu ab'omu byalo. Government will aim at reducing the speed and the intensity of transmission within the next 42 days, so that the number of new cases is less than the available bed and oxygen capacity in the country. This is the Kibaro Wanangi. This is the Kibaro. The Kibaro is minimize the Kusiga, so that Kusiga is to infect, so that you are able to treat the few that are infected. Because if you do that, if you don't do that, if you have got so many infected people that you can't care for them, then you would have entered the league of the United States and Italy and Spain and the UK and India. That's what happened to them. That's what happened to them. It is because we did the things in spite of being opposed. I was being opposed. When I was saying, please avoid infecting one another, I will talk about that later. B. So this is strategy number one. Kendeeza okusiiga okuturrana Runyankore is more precise. Okuturrana atwine Abaganda tugamba tutya, Abaganda ab'engoma okusiigana. Because Runyankore okuturra, you give him or her. Okuturrana, you Okusigangana. Okay. Okusigangana. So that minimize the okusigangana so that the infected people are not more than the beds in the country. The treatment beds, the three types of beds: the standard bed, the high dependence, the intensive care. Those beds, they are not the same. Then secondly, ramping up oxygen supply. Ramping up is their own word. Ramping up means increasing. I'm using Musenero's English. Because for me, I would say increasing. But for them, they say ramping up. I don't know what ramping up means.
Increase very fast.
Oh, okay. Okay. Increasing the supply of oxygen to all COVID-19 treatment health facilities and optimize the available care capacity so that it can adequately handle current and new cases over the next 42 days. I must commend Ugandans. Over the last 12 days, many have heeded my directives and the Minister of Health SOPs. Because I talk to some of my mobilizers. I ring somebody, Mulimutieyo, twesibide mu nyumba. There's somebody I spoke to in the Kawempe area, Mulimutieyo, twesibide mu nyumba. Nabano mulijo tebakyazanyiramu. Children are no longer playing in the compound. And we have locked ourselves in the house. That is the spirit. The majority of the people have listened to my appeal. And one of my brothers told me that they are taking the sanitizer at home. Sanitizer the waragi. So that's not bad. I don't recommend the sanitizer for anybody except for sanitizing hands. But if you can't avoid it, it's better you sanitize yourself at home, in your home. My mobilizers in and around Kampala inform me they are staying in their houses more and more. and they inform me they are sanitizing more and more in their homes. I've also observed marked reduction in congestion around Kampala and more use of masks, meaning people are increasingly adhering to the SOPs. I thank you and commend you more for this patriotism. Despite this positive trend, we need to do more to preserve and protect our health system and hence our lives. You see here, we need also to protect the health workers so that they protect us. Because one of the problems in the US and Europe was that the health workers were so overworked that they started dying. Because when you are overworked, when you are very tired, you even forget to take precautions. So you get infected and you die. The health worker now dies. After I remember Mr. Boris Johnson, the Prime Minister, was saying we need to protect, I don't know what they call it in the UK, that national health system of theirs. The disease was not only threatening the population, but also threatening the healthcare system. If all the doctors die and all the nurses die, then what do you do? They die, why? Because they are overworked. Somebody doesn't sleep, patients are so many. In the end, he will make mistakes. He will no longer take care. To achieve the above two strategic objectives and augmenting my observations above, starting 2200 hours today, 2200 hours is 10 o'clock, 18th of June 2021, I'm revising and updating all the directives I issued on the 6th of June 2021. The revision is as follows. Public and private transport. It has been observed that taxis, border, drop passengers at the district boundaries to be taken over by their colleagues waiting across the boundary district, which may result in further spread of the virus in the communities. Additionally, it has also been observed that despite this directive, human beings walk across district boundaries. This, therefore, has not fully achieved its intended purpose. It has achieved because many people are voluntarily staying at home, but there are those who don't listen. Furthermore, the movement of individuals fuels virus transmission, and without limiting the movement of persons, which leads to mixing and remixing of individuals in the different categories of infected and non-infected. This needs to be stopped since it is the cornerstone of the current exponential transmission. The virus does not transport itself. The virus is transported by human beings. The virus is not the problem are the human beings and their conduct. Because if the human beings listened, this virus is nothing. Actually, this is not really a problem of the virus. Because this is not like AIDS, that it is not curable. It is curable, it is preventable, but it is more the human, the society and all sorts of wrong actors in the society who don't listen, who don't care, So this is the issue we need to deal with. Therefore, my directives are as follows. All cross-boundary district and intra-district movement of public transport and by private vehicles or border borders is hereby suspended for 42 days starting today. No movement of public transport, car, or border, or even private vehicles. I will tell you the only exception later. So all of them, all of you, except if you are in some categories which we shall I'll mention later, don't move. Stay where you are for 42 days. Why 42 days? Because we know that this virus, once it doesn't spread, in 14 days, it gets out of your body. Or if not 28 days, if not 42 days. However, all cargo trucks and pickups will be allowed to travel within and across boundary districts with a maximum of 2 persons, including the driver. For the cargo vehicles, they will continue moving by day and by night, but having only two passengers, 2 people, the driver and 1 person, or even the driver alone. Public, private vehicles or border will only move to transport the patient, the ill, of whatever illness, on authentication and availability of evidence from either LC1, RDC, or a health worker. So, the vehicles will only be allowed to move if they are carrying a patient, either from the village to the LC3 or what do you call it, Health Center 3, or from Health Center 3 to the district, but on referral by the medical worker at the Health Center 3. From the village to the Health Center 3, the LC1 would be the one to allow. To say this vehicle is not taking a visitor, okukyara, is not taking a person going to do whatever, but a patient, a woman who wants to deliver, somebody who is sick. The public vehicles and the private ones can transport. Not passengers, but abarwadde, sick people. The other time when we had a lockdown, we had a problem of handling patients. So this time we have found a solution. We have said no, freeze all the vehicle movement, whether public or private, except for patient transmission from either the village to the Health Center 3, or from the Health Center 3 to the district, or from the district to even Kampala. So therefore, all passenger vehicles are frozen. Their movement is frozen, except for the transporting of patients. Except where they may carry patients, also the border-borders can carry patients. They can carry patients. But if we found that you are pretending to be a patient when you're not a patient, and the border-border is carrying you, we shall penalize very severely that border. And of course yourself. Except where they may carry patients, borders will not be allowed to carry any passengers, but only carry merchandise within the same district, with the exception for border movements within and across the Kampala-Wakiso-Mukono Metropolitan Complex. The ones of Mukono and Kampala and Wakiso, because they are more or less the same, those ones can move. But move with cargo, the borders only carry cargo, not passengers. Why? Want passengers to stay at home. This is the whole thing. Want the passengers to stay at home. So that, because we are the ones who are spreading the sickness. The virus has no wings that it can fly. This virus cannot go beyond, is it how many meters? 2 meters. It cannot go beyond 2 meters by itself. So, who is spreading it? People are dying, we are burying, I'm getting phones. We are just killing ourselves. Don't accuse the virus. No, please. The virus can defend itself in the court and say, look, I'm not the one. Me, I just go 2 meters. How can I? The virus can defend itself. The virus goes only 2 meters. So who's taking the virus all over the whole country? People are dying. We are burying. No, please. It is being taken by us. We are the ones taking it. The Right Honourable Prime Minister and the Minister of Gender and Social Welfare are hereby directed to ensure that the vulnerable population's needs are adequately assessed and taken care of to avert unintended suffering in this period. These are the groups who depend on daily earning, especially in the towns, especially in the Kampala area. The new Prime Minister and her group are directed to quickly assess what these people need, so that we may give them support for this limited period of 42 days. Further, the Minister of Health and the Kampala City Council Authority are hereby directed to make all the necessary arrangements to ensure all individuals that require medical care and medical evacuation in Kampala-Wakiso are taken care of. Across the country, the resident district commissioners working with the chief administrative officers and their district health officers are directed to make all the necessary arrangements to ensure all individuals that require medical care and medical evacuation in their respective districts, COVID-19 or otherwise, are taken care of. And that's why we say vehicles can be used for patient evacuation. So that should not be a problem. But at their own, men at their own cost, not necessarily the cost of the government. Because that also will delay us if we go to government money. The patients will pay and the vehicles will move them. We want the tourists to keep coming. The tourists who are coming from countries where they have already been fully vaccinated can continue coming. And they can move. But they will only be moved by registered tourist vehicles, which will be the ones allowed to move. These should move directly to their destination and designated places. Emergency vehicles, police and army vehicles, and essential workers' vehicles will be allowed to move. I have defined the essential sectors, and where there is need for additional clarity, the Right Honourable Prime Minister will study, search, and communicate. Among the essential health workers include doctors, nurses, pharmacists, veterinary doctors, and other essential health staff. Details of other essential sectors will be worked out by the Right Honourable Prime Minister and her team, like the utilities, electricity, definitely those ones. The essential workers will be given specific identifications. Curfew, it is observed that some sections of the public are not adhering to the curfew hours. 9 o'clock to 5:30 in the morning, what they call morning, the Europeans. But in our language, we say shayi eshatu z'ekiro okuhisa shayi 11 n'ekicweka z'akasheeshe. Saa 3 za usiku mpaka saa 11:30 za usiku. We don't call night morning like the Europeans. You know, Europeans are wonderful people. They say night, they call it and we follow. Even me, I'm saying 5:30 in the morning. It is as if I feel as if I am in Utabika. As if I am a mad person. How can I call night morning? Because in Europe they have a different system, so we just follow blindly. So please, curfew has been from the 3rd hour of the night, saa 3 za usiku, to the 11th hour and a half of the night, saa 11:30 za usiku. But because of the anglicization, I said 5:30 in the morning. Can you imagine? A member of the Wasita clan saying that Shai Kumine is morning. No, it's madness. Morning is 7 o'clock. What they call 7 o'clock. Shai Moya Kashesh. As such, the curfew time throughout the country, because people are not serious. When I see these people who have died, you hear people who have died. Tumboine Manzi, our chairman in Kavari, our permanent secretary, Kagorichi Vumbi, Kajabo Karsoke. I'm getting from all over the place, telephones, so and so has died, so and so has died. Imagine. And yet we told you from March last year, I said, you people, and when you people listened, we controlled the disease. That's why today we are talking over only 400 people. In the US, they lost 600,000 people dead. So, hii mchezo lazima ikome. As such, the curfew time throughout the country is pulled back to 1900 hours from saa 1 ya usiku mpaka saa 11:30 ya usiku. But if you want to use the English way, 1900 hours, that is the military way, 1900 hours. But the military also has got uzungu ndani yake. Because they say 1900 hours, because they start counting hours at midnight. Can you imagine? Africa wanangi. So anyway, saa 1 usiku mpaka saa 11:30 usiku. But in the English way, 1900 hours up to 5:30 hours, or from 7 o'clock p.m. to 5:30 a.m. in the morning, according to the English way. Borders will only be allowed to move only up to 1700 hours, which is saa 11 ya jioni. Saa 11 ya jioni. Education institutions. Testimonies from credible sources indicate that schools had been deliberately silent about infections among the students due to fear of closure. The schools were hiding sicknesses. All schools and institutions of learning remained closed for 42 days. The Ministry of Health to reactivate village health teams under the community engagement strategy to strengthen sensitization of the communities. In the villages, please watch out, because you know one another. In the villages, these villages have like 200 homes. Everybody, you know everybody. If you get somebody sick with the flu-like symptoms, inform the health center 3. And the Minister of Health here will give guidelines of how they should react. They should work out a plan how people should go from. In the meeting yesterday, they were talking of Health Center 4. I said, that's too far. I want the whole contact to be between Health Center 3 and the village. The village should report to Health Center 3. And then the Health Center 3, these people work out a plan. How will they, can they all have pikis and come and take sample and send it to where? Because if somebody is sick, I think it is not necessary to go. They will work it out. But for me, I don't think it is good for the patient to go to the health center, because when he goes, in the process is infecting other people. It may be better to stay. It's a bit, it needs a little bit of organization, but it may be better to stay at home and somebody from health center 3 and find you there. You go and see, look at that. These health center 3s are not too many. They are like 2,000 in the whole country. So we can mobilize 2,000 motorcycles, and they start doing that linkage. The Minister of Local Government is hereby directed to support the regional task forces and the district task forces to be reactivated and supported to reinforce the compliance of all SOPs. The Minister of Finance and Economic Planning is directed to support the regional task forces, and the district task forces should be reactivated and supported to enforce compliance of the existing SOPs. International and cross-border travels. Entebbe International Airport will remain open, but we shall ensure the no virus or new variants enter Uganda. Uganda is a landlocked country. All movements, or cargo movements to and out of Uganda will be allowed without any disruption. Cargo truck drivers at the land border crossings will be tested, allowed to move, and be followed up at the designated seclusion areas and holding places for cargo trucks. Cargo trucks should no longer park in the trading centers. We should go back to our plan of designated seclusion areas. That's where they should park. Not parking everywhere. That's what we had done the other time. I don't know why people abandoned it. So the cargo driver, the sample is taken, he moves on so that we don't cause a congestion. And when the results come, we shall find him where he is and say, you are sick, go this way. The Minister of Works and Transport is hereby directed to reactivate the operations of the seclusion areas for cargo trucks. The Joint Intelligence Committee to monitor compliance of particularly the private cars allowed to cross the borders to ensure total observance of the SOPs and guidelines. I think here Dr. Musenu and her group will have to sort out that issue of the passengers. I think you need to refine it. Passengers, which passengers should be allowed to come? Because we are saying no passengers except the sick in the whole country. Here inside the country we are saying no passenger except the sick. But here you seem to be saying, yeah, passengers from outside. You clarify that.
The airport, people who are arriving other than the tourists.
Okay, the returnees and all that. Okay, clarify that. They will clarify these people. Because remember, within the country, everybody, you stay home except the patients are the only ones moving. But now, these people, they are saying that for returnees, that should be clarified. Okay, if you want to allow the returnees only, how about the ones who are living now? What do you do with them? You need to sort it out. The ones who say, I want now to go, sort it out. Non-cargo cross-border movement, except for licensed tourist vehicles, is hereby suspended for the next 42 days. So now here you are. Awo yogede. With the Baganda we say awo yogede, you have spoken. Because sometimes you can speak, but you speak in nonsense. With the Baganda we say, it is as if you have not spoken, although we have heard your sound. But Temuri can't. So now, the only cargo movement. So they need to clarify the returnees. They are not tourists, they are not cargo, they are returning. They just bring themselves back. Okay, thank you very much. We don't want you to be stuck outside there. But how about the one who wants now to go? You sort it. They will sort it out. Non-agricultural activities and markets. Efforts have been made to bring on board different actors, including Kampala's Capital City Authority and Ministry of Works and Transport, among others. However, the surge of crowds has not sufficiently subsided, despite the effort to enforce social distancing and the use of face masks. This might not take away the danger of spreading the COVID as envisaged. So therefore, my directives are as follows. food market vendors should revert to the presidential directive of March 2020 to stay in their places of work. Bali abachara the ones who camped in the markets and were not going home, those Bazira, those freedom fighters, if the Minister of Health could give them bed nets, free bed nets, so that they are not bitten by mosquitoes, they can camp in the market and instead of for Barwanya, very well, Twachikolanga, would camp in the forest. So, Minister of Health, move quickly, give these market people bed nets, they can camp there and sleep, each one. When you sleep, don't sleep, don't be together. Because we have found that in the army, that causes inspection. People sharing rooms, it's not good. Don't share rooms. Let each one, even sleep outside, but alone. Don't share rooms. Chikubo and other business centers should be closed, and the situation reverts to the presidential directive of March 2020 as far as the Chikubo is concerned. Those Chikubo places are very dangerous, but the food markets should remain open, only that the sellers should camp there, assisted by the Minister of Health to give them overa to shield the rain and the nets for the mosquitoes. Barriers. Whereas the compliance on this has been low, the high risk factor assessed is the pressure of people seeking permission to go and attend barriers from place to place. This poses the highest danger of spreading the virus and breaches of the strategy. Therefore, barriers to be restricted to the core family as applied in the military. One of our people, first of all, my uncle died during this corona. I never went to bury him. He was buried at Raiktura, next to my father and mother, but I never went to bury him. Because I was adding nothing. I was not going to resurrect him. But I would bring a crowd. So my uncle died, buried at Raiktura in our burial place. I sent my young brother Nzeire with a few people, you go and bury. What difference does it make? Just gathering, when there is so much danger. My cousin died during this. I sent a few people, you go and bury. Now, the other day, one of our people, Pius Mujuzi, former member of parliament, died. He was an army officer. Then I got people, send a representative. I said, no, I'm not going to send a representative. I will send support, but not a representative to make a speech. This is not a normal time to go and make speeches and what. And he died from corona. Yeah. So I'm not going to send a representative because this is not a normal time of sending representatives. No. Kajawo Karasoke died. I sent support to the children. I didn't send a representative. Because people behave as if this is a normal thing. Those things happen, those cultural, social, happen because when things are normal. But when things are not normal, and you are told that, today I was speaking with the Omudinja of Bondobujo, our soldier, Lieutenant Colonel Kamia, who is the king of Bunduwijo. His mother died, one of our people. Somebody was saying, you send somebody. I said, no, I'm not going to send anybody. I will send support. What is needed is support, which can be sent virtually, but no representative or president to make speech as if we are in normal way. So these barriers are being mishandled. Let only the core people of the family be there. Like I handled my uncle. I told one of my young brothers, and said, you go with a few people, 10 people. That's enough. When the crisis is over, we can have an occasion and we'll remember him. The committee I put in place during my last address, led by Major General Soke and Dr. Musenero, should ensure the institution of a well-coordinated mechanism which enables a few family members to transport the dead body for burial. RDC and DPC should ensure that all SOPs are observed and not more than 20 people attend the burial. And avoid gatherings and visits to the deceased family after burials, which will promote spread of the virus. Bars, discos, sports betting and cinema halls, despite all the directives, the bar owners and clients have not fully adhered. I now direct KCCA, URA, and local government authorities to close and seal off all the bars that breach this. And also cancel their licenses forever. Cancel their licenses. You violate, you will never open again in Uganda unless you go to Kenya or South Sudan. Police should accordingly arrest and charge with hefty fines. We are not going to arrest you and put you in jail to eat our free food. No, you will be the one to pay. We can raise money from you instead of us feeding you. It serves no purpose arresting the revelers while allowing the owners to reopen the following morning. All other sectors which are not specifically mentioned should consider themselves closed for the next 42 days. Institutions and organizations, although most offices have complied with the 30% physical presence at the workplace, the directive ought to be reviewed. Current information so far obtained indicates that despite this scale down, infection rates in this area are very high. I have therefore decided that we reduce further to 10% of staff in non-core ministries, departments and agencies. The Right Honourable Prime Minister, working with the Minister of Public Service and the Minister of Health, will redefine the non-core MDAs. Factories and construction sites. Whereas this directive is being adhered to, it remains tricky because in some areas workers have to cross different districts to reach their places of abode. Therefore, a well-intended plan would yield less because of circumstances. Therefore, I direct that where possible, the factories should remain open. Factories should remain open. But where possible, the workers should be housed at the places of work for the next 42 days. I encourage the factory owners to work with the Minister of Health to ensure only uninfected workers enter the camps, the work sites. Where camping is not possible, the factory owners should work together with the technical committee to agree on a safe alternative to enable the factory activities to continue safely during the lockdown period. Places of worship. The churches, mosques, and sports sessions are congregating settings and are a source that fuels rapid virus transmission. All places of worship and sports events remain suspended for 42 days. Here, I had a problem with last year when people were saying that it's really amazing. They were saying that if they don't go to church, that they will not pray. Well, the good thing is that I have a bishop in my house these days. After 150 years of Christianity, one of my children became a pastor. I had never had a pastor in my family for the last 150 years. The Christians came here in 1877, the CMS, and the Catholic Church, 1879, Maper and others. 1877 it was Mackay and the CMS. So that's all 150 years almost. I had never had a priest in my family, but I now have one, my daughter Patience. So last year I discussed with Patience. I said, please, God is in all places. That's what I studied in the Catechism, 1957, when I was being confirmed. Rahanga ayumyanya yona yona. God is in all places, is omnipresent. That's what they say in the. So you don't have to go to church. You can pray where you are. And these days there are even these TVs. I normally see Mama Janet watching those women from America. There's a woman called Margaret. There's another one called what? She's always watching them. They're always preaching in my house there. Even me, I attend once in a while when I'm not rushing around. I know what there are some Nigerians which Mama watches, some Nigerian people. One of them came here called something what? Adeboye came here. I can attend Adeboye is preaching from Nigeria. So why do you have to expose people of your church to gathering? This really should be very careful. Should be very careful. God says you should not be. God should not be mocked. Don't mock God, saying that you are doing the work of God when maybe you are after some other things. It's not correct. So it's very dangerous to gather and sing, especially sing, because when you are singing, you are. Monitoring of the compliance. The Joint Intelligence Committee, working together with the Technical Intersectoral Committee and Major General Robert Rusoki. Rusoki is there. He's not putting you in uniform. He's putting you in a suit now. You may think that he was an ambassador also, so he's quite a Polish gentleman. Major General Rusoki is there. Are directed to closely monitor the compliance and enforcement of these directives. Except where specifically stated, all these measures take immediate effect and will last 42 days when I will make subsequent revision. For our lives to continue, the following sector fully should function. Because these directives are not blind, they are really well calculated. These sectors, once they are open, even if we have problems here and there, we shall survive, as we have done since March last year. Sector 1, agriculture. Fortunately, agriculture is a decentralized activity. People don't gather so much, so they can continue working. Industry, especially manufacturing and tourism. Cargo transport. for the distribution of factory goods and agricultural goods, health and medical services, security, utilities, meaning water, electricity, mass media, telecom, banking institutions, garbage and waste management, retail shops. Retail shops should remain open, because retail shops are not the same as a chikubo. Retail shops, you find one person there selling with the shop assistant. There's no crowding. The retail shops should remain open, because fortunately they don't encourage crowding. So if the farms are producing, the factories are producing, the cargo trucks are moving, the health centers are working, the army and the police are active, the utilities are open, we shall survive. We shall suffer but survive, as we did last year. I have thus categorized these as sectors, these sectors as essential sectors. At this critical moment, I wish to call upon all the leadership structures throughout the country. Every village has community health workers known as village health teams, VHTs, who are in touch with families and keep records on the health status of the village. For example, they know how many people are in the village, how many are pregnant, how many children, etc. These VHTs should now be leveraged to increase population awareness, support for SOPs, and then know which people need medical care, and liaise with the health center 3 to evacuate these people at the cost of the patients. The issue here is to minimize movement and only allow unavoidable movement, which includes patients. The Ministry of Local Government has undertaken mobilization of these leaders, and they are fully aware of their roles in the COVID-19 response. All district COVID-19 task forces are hereby called upon to awaken the national wide response system up to the community level, to the village level. On the issue of vaccination, the above measures will give us a temporary relief. However, we know that the ultimate solution to this COVID-19 challenge is to get our people vaccinated. To date, we have vaccinated a total of 869,915 people, which accounts for 90% of the 900,000 doses we received. Of these, 57,000 have received both first and second dose. Yesterday, the 17th of June, we received another 175,000 doses. And we're expecting additional 688,000 doses of AstraZeneca vaccine in early August. I have directed that these doses be prioritized to give second dose to those who have already got their first dose, so that the vaccination is complete. Government is working with the Chinese embassy to bring in another 300,000 doses of Sinovac, and discussions are continuing. I am in touch with so many actors to solve the issue of vaccines. Either the Russian, the Sputnik, or the Chinese, or Johnson & Johnson, we shall get the vaccines. But you must have seen the Prime Minister of UK, Boris Johnson, saying that he can't open now, although the majority of the British are now vaccinated, because there is a new variant that is not preventable by the vaccination that has already taken place. That's what he said. He said it was, and when I have checked with my scientists, they all confirm that even this vaccine, which people got here, the 2 doses, covers the original Wuhan, the Chinese one, and which other one?
Covers most of the Chinese one, the Kampala strain, the Nigeria strain. It's only the South Africa strain which shows lower protection.
So the vaccine we have got covers which ones now?
It covers
The Chinese,
yes.
the Indian,
We don't yet know, but India has used it, so we are watching to see if India goes down.
So the point is that because the virus keeps changing, even vaccinations, these vaccines which are there now may not fully cover the risk. So that's why really the public health, the prevention, is still the correct one. We are working on our own vaccine. Actually, our vaccine will be better than all those.